Hello, everybody. This is Alan Fine. I'm here with Peter Velitis, who is the Senior Vice President of Airline Relations for Internova, which you know was formerly Travel Leaders Group. We spoke to him back in July about the airline industry. We're going to find out what's been going on there since and more on Insider Travel Report. So in the absence of the guidance and with the airlines stepping forward and doing their share, groups are coming up with different ways to standardize the travel. And let's talk about CommonPass, which is trying to do just that.
Yeah, absolutely. So where we are today is there's an absence of any government strategy that is saying we've adopted, whether it's IATA's, ICAO, or any global organization, whether it's saying we agree with safe travel, world travel and tourism, so we're at a point where governments are saying, we want you to take a test. So how do we move forward? The first step is, unfortunately, there's no place where even the WHO Health Organization doesn't have, there's no repository of all data, right? As a government, we have to say, will a government accept testing instead of quarantine? If I can take a test, if I as a government said, I want to open my border to, don't want to import the virus, don't want to export the virus, so there'll be a test coming in and a test going out. So everyone traveling on that plane. So if I'm on that plane, I'm sitting happy that I know everyone on that plane is negative. I'm still going to wear my mask because there's always that small percentage. However, how do I know the test was real? All these countries now that want a PCR test or a rapid test, there's no way of validating it. Is it real? Do I have a real test?
Well, you were saying sometimes it's just cheaper to get a copy than to get a test.
Yes,
and this is feloniously copying.
Yes, and this is exactly what happened in Europe. During the summer months, whether it's migrant workers coming in from the Baltics or Eastern European, there wasn't a lot of testing, but countries had a rule that if you come in over the land border, you needed a negative COVID PCR. They didn't know where to go to get it. So you know what? They made them up. One person got it for $5 or whatever was selling it. And then it's a PDF. You have a program and just change the name, change the date. No one checked. There's no QR code. Nobody went to a lab. And you had the spread of COVID because not everyone. So how do we prevent that, right? Here comes CommonPass and a medical registry. The fact that all it says is I'm okay to, green light, red light. We don't have the HEPA, which is the US issues, or GDPR, or any issues around the world. The example we like to give, or I like to give, is I'm Mr. Kim from South Korea, and I have a negative COVID lab result. Well, who's going to be able to read Korean, and who's going to know which Mr. Kim it is, right? So by having the lab or a medical facility send the result to CommonPass or any medical registry and say, he's good to go. So in this test, we had the app on our phone. Before we boarded, the United people asked, could I see the app? So we showed them the QR code, which they could read, and it said I was okay to travel. Now I am negative, I get on a plane. Assuming everyone had a negative on the plane, you now feel a lot more comfortable. When we landed in Newark, again, there was a United person, but in reality, this would eventually be CBP, Border Control. And as you go up and you scan, whether you scan your passport or mobile pass, because mobile pass has the QR code. So think of it that way. I go up to CBP, whether it's tied into my global entry or mobile pass, or if I just have my passport, I can show the CBP, my QR code, I, Peter Velitis, have negative, welcome to the United States. It eliminates any possibility that you have either a fraudulent result or an old result.
So when I heard all this and we ran it in Insider Travel Report, I was overjoyed. But the reality is that second thought was, okay, now how many airports will adopt this? How many governments will adopt this? Airlines. I mean, and there are competing versions of this, which is all good.
Yeah.
But give us an overview of that.
So United Airlines is full force with CommonPass because they see the value. Us as travel advisors, folks, we want a medical registry. We want to be able to say, we want a government to accept testing for quarantine, right? So that's the first thing.
You say testing for, we don't want quarantine. This is as a replacement.
That's correct. That's correct. So we then want, there's the issue of who's going to pay for this.
Right.
All the governments ask that. In an airline ticket, there's the Q charge. So there's a mechanic within an airline ticket where the airlines can put in that you will take, if you're doing a whatever the app costs or whatever, you can put the charge on there, right? It's not scalable at the airport. I'm telling you right now, there's no way we can send people to the thousands of people. Look how many people travel. I mean, if you just take the daily travelers, the TSA 800,000, right? There's 1.2 million tests on a daily basis in the United States. Throw in another 800,000, that doubles the amount of people that has to be tested. It's not scalable at the airport. We should have the facility at the airport for the last minute traveler, for somebody who shows up something that doesn't work.
To play catch up. In other words, do your homework, but if you got to play catch up, that way it would be handleable.
That's correct. So here comes in the medical, so a CommonPass or anything similar. I now know I'm going to travel. I now know that the government, that the country I'm going to, or for that matter, a state, right? So let's say the state of New York says, or the state of Connecticut, which has 72 hours, I now go to Quest, CVC, whatever lab that's on the list, and I go take my test. I want the lab to send it to this medical registry, CommonPass or whoever else, Clear may do this, TSA I want to be able to have something on my phone that is verifiable
and accepted
by all, and say, yes, I just showed up. Here's my test. It's legit. It's real. Good to go. And you're on your merry way. That will open up. That will help travel advisors book with confidence their customers. It will help states in the United States allow for the freedom of travel because we're not importing the virus, not exporting. And it will allow governments to have whatever confidence level they want to say that I want 2 tests, 3 tests, whatever they want, but put it on an app so that way I can travel with an app and it's legitimate.
And the app is able to keep track of all that. In other words, as each state or country complies or uses it, they'll put in their requirements and the app adjusts. I mean, the traveler will then be hit with the requirements of that area. That makes sense to me. If you hadn't made this attempt, you gotta start with the first step, and that's what you've done. That's what CommonPass seems to be. And even though you feel like, oh, it's overwhelming, it's a good thing we're on the path to a solution.
That is actually the positive message, is that it's exhausting, folks. It's a lot of work. It's a lot of calls. The CommonPass people who are, it's backed by the Rockefeller nonprofit, World Economic Forum, and then there's others in there. But we have to start somewhere, and it has to start with, hey, Mr. Government or Mrs. Government, we want to come to your country. You want us to come in because travel and tourism is important to your bottom line, right? So here is a way where I can now take a test, because you can. There's an abundance of testing in this country. There's a lot of rapid, and every day there's new, more improved. So it's not scalable at the airport, right? So take a test, come to the airport, right? You're negative, get on a plane, and here is my app that shows you I'm good to go.
I could actually sign off here. Peter, thank you so much.
Thank you.
And this is Alan Fine for Insider Travel Report.